Honourable Speaker, Honourable Prime Minister, Honourable Leader of Opposition, Honourable Deputy Prime Ministers, Honourable Cabinet Ministers and Assistant Ministers, Honourable Members of Parliament, I rise to express my strong support for the 2025-2026 National Budget under the theme Building Security, Stability and Prosperity. This budget reflects our collective vision and commitment towards a stronger, healthier Fiji, one that places the dignity and well-being of our people at the center of national development. The Ministry of Health and Medical Services has been allocated a 465.6 million Fiji dollars, a strategic increase in funding from 2024-2025 budget allocation. We are grateful for the confidence placed in us to continue strengthening the health system, improving equity, and securing better health outcomes for all Fijians. Honourable Speaker, sir, the government should be commended for its focus for prioritizing and investing in its greatest assets, the workforce. This is more so in a social service sector, where the workforce is the heart of the industry. Without a competent and committed workforce, any plans to provide quality services, including healthcare, are doomed to fail. The Ministry is delighted with the 3% salary increase for civil servants, and believes that this is a positive step in ensuring that our workforce is appropriately remunerated for the wonderful work that they do each day, walking on dirt roads through rugged inland terrains, crossing rough seas in fiberglass boats, or crossing rivers in bamboo rafts in their untiring service to the people of Fiji. The early post-COVID era was marked by unprecedented escalation of health workforce exodus that threatened the ability of the health system to deliver healthcare services to our people. The ratio of health worker to patient was severely affected, and the impact on our people, if the trend continued unchecked, would have been devastating. The quick responsive actions of the government in the last 2 financial years to improve the employment conditions through raising retirement age, salary increases, remunerations for overtime worked, and other allowances have made an immediate and significant impact in stabilizing our workforce. And this will augur well for the people and communities we diligently serve. The largest increase in allocation is for our people, our doctors, nurses, allied health workers, and corporate support staff, who are the backbone of Fiji's health system. The allocation of established staff has increased by 26.3 million, while that for government wage earners have increased by 3.6 million for the next financial year. This investment supports recruitment, rural deployment, retention, and training. We are particularly focused on addressing vacancies in remote health zones, expanding outreach teams, and supporting postgraduate and nursing specialized programs. And with this investment comes accountability. Our ministry is enhancing workforce performance, monitoring and introducing peer-based learning models, and strengthening leadership, training for frontline supervisors. A healthy workforce builds a healthy nation. In January of this year, Honourable Speaker, sir, the Ministry declared a public health outbreak of Fiji, in Fiji of the HIV. We are now estimated 7,000 people. There are now estimated 7,000 people living with HIV, and the ongoing upward trend is deeply concerning. We are grateful that this budget allocates 10 million specifically to contain the spread of HIV. These funds will support expanded testings and counseling sites, especially in high-risk areas, public education and youth engagement campaigns, the phased introduction of needle and syringe programs aligned with global best practices. We also acknowledge the support of our partners, Australia, New Zealand, UNAIDS, WHO, the Kirby Institute, and all UN organizations in Fiji who are supporting us in this fight. However, this is not just a health issue, it is also a social and human rights issue. We must break the stigma empower communities with accurate information, and stop discrimination to ensure that everyone, regardless of background, has access to prevention, care, and treatment. Today, I'm asking all of us in this August House and those listening into the televised parliamentary sessions to work together and act now before it's too late. Do not discriminate against those with HIV infections, but help them and support them to get the care that they direly need so that they can continue to be productive members of our community. Honourable Speaker, sir, we welcome the 5.3 million increase in the Ministry's policy administration budget. The Ministry also supports the critical reform, the removal of R, or requisition to incur expenditure under the direct control of the Permanent Secretary. This shift strengthens oversight, transparency, and responsiveness. This should further improve implementation of projects by allocation of funds on a timely manner. To ensure this reform delivers results, all RIE-funded projects will be subject to quarterly reviews. New financial and operational dashboards will improve accountability and strengthen monitoring. Internal audit will have a standing mandate to track performance. Honourable Speaker, sir, in modernizing Fiji's health laws is a key part of our reform agenda. In this financial year, we are pushing ahead with a review of critical health-related legislations with a number of anticipated to be submitted to Cabinet at the end of this calendar year. The legislations under review are the Burial and Cremations Act of 1911, Public Health Act of 1935, the Radiation Health Act of 2009, the Mental Health Act of 2010, the Nursing Act of 2011. The Ministry will submit the proposed revision for the Quarantine Act of 1964 and the Burial and Cremation Act of 1911 to Cabinet in September of 2025. These reforms are essential to ensure that the regulatory foundation of our health system is robust and supports current and future needs and international best practices. We acknowledge our health partners who are supporting the Ministry in this effort. We also intend to begin in the new financial year and with the support of the Office of the Solicitor General, the processes for the review of an additional number of legislations, which include the Food Safety Act of 2003, the Tobacco Control Act of 2010, Tobacco Control Regulations of 2012, and the HIV Act of 2011, as well as the establishment of new legislations to cover important health services such as the medical laboratory services in Fiji. Honourable Speaker, sir, in addressing partnerships for development, the coalition government has established the political and governance environment that has allowed government agencies like the Ministry of Health and Medical Services to engage in a meaningful and productive partnership with our partners. The Health Ministry has continued to work closely with our major development partners, Australia, New Zealand, Japan, Korea, India, China, and UN agencies, including JICA, COICA, WHO, and the World Bank, and others who have contributed to strengthening and supporting various areas of our health services. I must also wish to acknowledge ADB, also, Honourable Speaker, sir, as they are now also looking into specifically health apart from infrastructure. We also acknowledge the continued support and engagement under our Development Partners Coordination Programme. In particular, we thank the support of the Australian Government and DFED under the Mobile Partnership towards the CWMH redevelopment project, government which is progressing well, meeting all targets for its deliverables. In addition, the DFED-sponsored renovation works for Hunisia Hospital in Kandamu has commenced, and the renovations for Taibino Hospital will follow suit. The Ndua Water partnership with the New Zealand government that resulted in sponsored renovations of primary healthcare facilities, including the newly built Ndonga Health Centre, and the nurse quarters at Momi Nursing Station. The support will now move to the Northern Division, with target facilities to be renovated. The Government of Japan for the new CT scan machine and 6 ambulances now distributed at our sub-divisional hospitals, supporting our patient referral system and reducing our need to outsource this service. The Korean government and KOICA for the much-needed renovations at our major health facilities. The Chinese government for the support towards the evaluation of our strategic plans that will guide and strengthen our future strategic planning for the ministry. Honourable Speaker, sir, the ministry is collaborating closely with the Indian government that resulted in the signing of the first ever Memorandum of Understanding with Indian Pharmacopoeia. The ministry will continue in its efforts to prepare for the 100-bed super speciality hospital donated by the Indian government, as well as work on an agreement to access generic drugs that are available at reduced costs in India. The ministry is also engaging closely with the Korean government and KOICA for the construction of the new National Rehabilitation Hospital in Tamavua in the next 3 years. Without a stable and transparent government, such fruitful partnerships would not have been possible to establish and sustain. Honourable Speaker, in October of this year, Fiji will host the 76th World Health Organization Regional Committee Meeting, or RCM, for the Western Pacific, and coinciding with the 30th anniversary of the primary health care. This historic event will bring together ministers of health from across the Pacific and Asia, along with our international health partners and technical experts. Hosting the RCM is both a privilege and a responsibility. It gives Fiji a platform to showcase our health leadership within the Pacific, share innovations in climate-resilient health systems, reaffirm our commitment to universal health coverage, strengthen partnerships for a healthier region. Our planning is well underway, and with the ministry establishing an inter-agency committee that will address the preparations, security requirements, logistical arrangements, and thematic priorities. Honourable Speakers, on resource utilizations and continuous improvement within the ministry is aware of its budget utilization and areas that need strengthening in monitoring and control. For the new financial year, to address procurement bottlenecks, supply delays, and administrative constraints, the ministry will implement and strengthen the following processes: closely tracking of monthly expenditure against work plans, regular engagement of divisional leadership team in the budget oversight process, mapping procurement pipelines against delivery milestones, and implementing changes for improvement. Honourable Speaker, sir, this budget is providing a clear pathway and direction on government's intent for improving the health service and tackling the health challenges of our time. Every dollar allocated to the Ministry of Health and Medical Services must translate into cleaner clinics, better medicines, empowered health workers, and healthier communities. The Ministry is ready to implement, guided by values of service, equity, accountability, and care. We will work tirelessly in partnership with stakeholders, government agencies, our communities we serve, our health partners, to ensure that our allocated budget for the new financial year is utilized efficiently and prudently for the benefit of the people of Fiji. Honourable Speaker, sir, let me conclude by reaffirming the Ministry's full support for the 2025-2026 budget, and we are proud to play our part in building a secure and stable and prosperous Fiji. I thank you, Honourable Speaker, sir.